Obie is currently a Navy commander and a general surgeon. He has deployed several times to Afghanistan. He's here to talk with us today about Afghanistan healthcare. Obie, when were you deployed to Afghanistan and how long were you there?
I've been deployed 3 times. The first time was in 2008, then again in 2010, in 2011. I've been there a total of 18 months.
Okay, great. So you have a lot of experience with the Afghanistan healthcare system, both taking care of Afghan patients and observing their healthcare practices. Um, what what are some traditional healthcare practices you've witnessed in Afghanistan, and how do some of those differ from what we've seen in the United States?
Well, they would have clinics and hospitals near the bases where I was stationed. It would vary depending on the time of year, what type of practitioners they would have there. Frequently, they wouldn't have specialty providers such as surgeons or obstetricians, and that care would just be performed as best by the practitioners that they had there. Their education would be varied. Some would have attended a more traditional medical school in Pakistan, and others, it was kind of hard to ascertain exactly where they got their training. I don't believe any of them were trained in Afghanistan.
Okay, what are some common health problems that the Afghans encounter?
Well, being a surgeon, I've dealt a lot with surgical issues, and very similar to the ones we have in the U.S. Simple things such as hernias. I did encounter a few cancers. There are also, of course, all the traumatic injuries, not necessarily related to war, but just day-to-day living in a harsh environment.
Okay, what kind of, when you've been encountering, okay, we need to stop.